If you have a loved one who's sick or disabled, then you well know that nurses are some of the most important people around. But if a nurse has had legal issues, sometimes that information doesn't get to all the people who need to know. Jessica Gertler takes a look at some troubling scenarios in Tennessee.
A car found wedged in the mud on the side of I-40 in Fayette County ended up being the center of a criminal investigation. State troopers say inside the car was meth, marijuana, and 600 prescription pills. And the driver, Letitia Hayden, was a registered nurse in the Mid-South. Investigators say Hayden admitted she stole the pills from her patients and was arrested on drug and theft charges. That was in December 2018. Weeks later, Hayden bonded out, and the staffing company she worked for fired her. Now it's unclear where she's living or if she's landed another nursing job.
That's because her license remains the same before her arrest. Take a look. There's no blurb, no mention, nothing on state documents. In fact, it reads, no history of disciplinary action on this license.
Same story when we looked at the national database called Nurses. We asked the Tennessee Department of Health why that is, since the Board of Nursing falls under their wing. They didn't agree to an interview and have been very vague in the emails they've sent us. Here's what we've gathered, though. A spokesperson stated there is no state law or rule that permits automatic action against a health professional's license if he or she is charged with a crime. Everyone is entitled to due process. Meaning while Hayden awaits her trial, the only mention we could find of her arrest was in a criminal background check.
There's no full proof to this.
Tasha Holmes has gone through trial and error finding the best caretaker for her mother.
You see lots of ads on the newspaper like at, Care for Mom or, a home for mom.
She ended up choosing a self-employed CNA, which meant she had to screen the person on her own. She held interviews, ran a criminal background check, did Google searches, but admits that still might not have been enough.
If I hire her today, she could do something illegal the next day.
There are thousands of nurses licensed in Tennessee, and very few were found guilty of a crime. Since January 2018, we counted 35 listed in the Nursing Board's disciplinary reports. But when we took a closer look at some of the cases, we discovered it took months, even years, after the initial arrest for their license to be suspended or revoked. Take this case for an example. Roxana Ernest was a nurse at the Memphis Cardiovascular Clinic, and for 7 years, she used a pre-signed pad to fill 972 prescriptions for herself and others. She illegally obtained 57,000 pills, including Ambien, Xanax, Vicodin, and Percocet. She was arrested June 1, 2017. Weeks later, the clinic fired her. November 2018, she pleaded guilty in federal court. But it took another 4 months after that for the nursing board to revoke her license. The state says when a nurse is under investigation, the file is flagged on a nurse licensure database. But the state wouldn't say if that's an internal flag or how the public can see it.
Until she's found guilty, it's an accusation.
Tennessee Representative Antonio Parkinson says due process is vital. He says he's open, though, to seeing how the board's process can move faster.
It's important that people get the opportunity to at least make their case for themselves.
Holmes says hiring a caregiver was one of the hardest things she's ever done. She suggests turning to nonprofits like AARP that provide checklists and resources to help with the process.
We've got to do a good job of sharing this with this generation of folks